Hi, my name is Olivia Gibson and I'm a third-year vet student at Tuskegee University College of Veterinary Medicine. Today, I'm going to be telling you how to prepare for second-year classes. If you're watching this, congratulations! You made it past first year. First year is usually when most students get weeded out, so if you didn't get weeded out, you're probably good to go and passing through till the fourth year and becoming a veterinarian, so awesome. As you've probably heard, this is the hardest year of vet school. Let's get started. The second year is a big year where life-work balance comes in. You need to make sure that you take off time, you take breaks. So our courses this semester: Avian, Exotics and Lab Animal, Grand Rounds, Clinical Pathology, Clinical Skills, Toxicology, Infection and Immunity, Intro to Pharmacology, Nutrition, and Veterinary Pathology. You're gonna have a couple of returning classes, which we all know and love. You're gonna have grand rounds. It's gonna be a little bit more challenging this year because you have to pick an article yourself. You're gonna have quizzes every week on everyone's presentation. You'll also have access to the research paper each group used to write their presentation, so you're gonna wanna use those and your best friend Control F in order to do really, really well on these quizzes. Grand rounds first semester is going to take you way more time than it did first year. So be prepared to have extra time to work on that presentation. Our second returning class for this year is Clin Skills. This year will be a little bit more hands-on, so yay! It's kind of combined with the things that you learn in ClinPath. You're gonna be able to do blood smears, urine analysis, and you're gonna be able to do a chicken necropsy, which is super fun. I feel like a lot of the equipment that we use is very outdated, so like your urine analysis strips, Dr. Egarin would tell us, you might not get a proper result because these strips are super expired. So the first one is Infection and Immunity. This one we also had first year. This whole semester you're gonna be focused on all of the bacteria. Infection and Immunity lecture is mainly taught by Dr. Wibbett, and she is super amazing. She goes a little bit fast, but her slides are super organized and really well formatted. At the end of the semester, you're gonna have like 1 or 2 PowerPoints on fungus, molds, and yeast. That's basically what the final is gonna be focused on. Additionally to Infection and Immunity lecture, you're gonna have Infection and Immunity lab. That is basically split up into 2 parts. The first half of that lab is gonna be making slides, doing staining, looking at things under the microscope. Another thing about Infection and Immunity labs is that you're gonna have a quiz every week. The second half of Infection and Immunity lab is actually going to be presentations. So you're going to be split up into groups of 4 or 5, and you have to pick a bacteria and basically do a presentation on it. So Clinical Pathology was pretty much the hardest course for me second year. So go ahead and prepare by getting a head start with blood stuff and just become familiar with all the different types of white blood cells, when they're present, what they look like, and things like that. This class is also pretty overwhelming. So you're basically gonna go over everything that's toxic to an animal. A big portion, especially of the last block of toxicology, is toxic plants. You need to know these. You're gonna have a plant lab where basically Dr. Ogden has a bunch of plants in the lab and you get to pick one and write a paper on it. I think the biggest downside about toxicology is that Dr. Ogden's PowerPoints are just kind of really hard to follow sometimes. And so I had to personally go back and like reformat every PowerPoint that she gave us. Avian, Exotics, and Lab Animal is a course that wasn't exactly what I expected it to be. Tigrim starts out teaching it. You're gonna start out with rats and mice, and then basically you're gonna go from there and do all kinds of species. Here are all of the animals that we went over, so enjoy learning about all of those. The least overwhelming class you'll probably have this semester is gonna be Nutrition. So Nutrition is formatted completely different from all the other classes. You're actually gonna have an account for a program that they sign you up for, and you're gonna have to do modules. But the modules are actually kind of fun. It reminds me of Quizlet and how it's formatted. Pharmacology. The first block or so, you're gonna be learning about what's called pharmacokinetics and pharmacodynamics. This is another course I'd really get a head start on this summer, and go ahead and familiarize yourself with absorption, distribution, metabolism, and excretion. Watch some YouTube videos and just kind of get familiar with the material. It is easier second semester, in my opinion. So you can look forward to that as you go through the trenches this semester. The biggest issue that I found with this course is there's not enough clinical application. So basically, they talk about, for example, opioids. Then they're gonna give you a whole list of different opioid drugs. You're gonna need to know what's their mechanism of action, what's the adverse effects, what's their metabolism like. All of this information for every drug can get really, really, really overwhelming. A big thing to know about pharmacology. You cannot cram for each test and then dump it. Although the teachers do kind of enable you to do this by giving you sample questions, so those will be your savior for the semester. Veterinary pathology. The beginning of it is a little rough, not gonna lie. The PowerPoints from T. Graham are very non-informational. So a lot of it is just pictures. He gives you handouts. I know these are like 10, 15, sometimes 20 pages. However, a lot of it is paragraph bulk extra material that you can just go through and delete. The second block of Vet Path is where it gets a little bit better. So Dr. Phillips and T. Graham both teach this block. Phillips did really, really well this semester, in my opinion. She goes through everything, and if you don't understand something, ask and she'll re-explain it. Throughout the first couple of blocks of veterinary pathology, you're gonna be introduced to a concept called morphological diagnosis. And you will be exercising making morphological diagnoses on everything throughout both semesters. And then last block, you'll have one of my favorite teachers, Dr. Gilbreth. She teaches cardio and neoplasia. In addition, VetPath had a couple different labs. We had a cardio lab where you actually got to dissect a heart. Other VetPath labs were led by different teachers, but a lot of these were just take out a microscope, here's some slides, here's a handout. The final thing about VetPath is gonna be your VetPath practicum. And it's, I think, of like a 3 or 4 page situation where it's, here's a case, here's some slides, now I'm gonna ask you a lot of questions about it. Second semester, anesthesia and surgery. Grand rounds, again, clinical microbiology, diagnostic skills, theriogenology, infection and immunity, again, pharmacology 2, systems, and veterinary pathology 2. The good thing about second semester is that you have some courses that are super, super hard and you really have to work hard on. You have other courses that kind of compensate for that. And so you can kind of pick and choose what you really want to focus on and then be super lazy about some other courses. So clinical microbiology is going to be a completely new course. So they're going to take infection and immunity and the materials you kind of learned from there and sort of apply it to more testing basis. Most of the semester in clinical microbiology is going to be different types of tests that you do to make diagnoses in the clinic. And then he's going to start going into cases. Dr. Nashar does super, super, super good at teaching virology or infection and immunity second semester. However, in clinical microbiology, I feel like he's not as passionate about that material. I think for that reason, I really struggled to pay attention in a lot of the classes. For the first half of the semester with all the tests and stuff, I found it super easy to just reformat the PowerPoints just a smidge and then make tables for all the different tests and what they do and how you interpret the results. Sometimes we would have quizzes after lecture. Be prepared for those. I think the 2 most challenging things about clinical microbiology is lectures themselves and trying to stay focused during those. Additionally, when you get to the cases, sometimes the questions are really hard to understand what he's asking or hard to know why we wouldn't know the answer to this question. Infection and immunity, or virology, is a continuation of infection and immunity from first semester, but this time we're going to talk about viruses. Yay! Dr. Nashar leads this one, and to me, he did super amazing. The best thing about this course is that his PowerPoints are consistently formatted, which helped a ton in this course. Additionally, at the end of a lot of his PowerPoints, he will have NAVLE practice questions. Know the answer to those because they will be on the exam. Additionally, he gives you like review PDFs of all of the information for each block. Please know those. You will have an A if you pay attention to those. Grand rounds. This semester, they've upped the ante once again, but you have to do a topic on a virus. He not only wants it to be on viruses, but also behavior effects of the viruses. So like, how does this affect the animal? Be prepared to have extra time to really work on those grand round presentations, even a little bit more so than you did last semester. Diagnostic skills, the more advanced version of clinical skills, I suppose. This course was like a little just kind of mesh of everything together. But the good news is labs this semester were super, super fun. Every lab we went to was hands-on. We get to work with live animals. You get to bring your own pet in, so you can have that to look forward to. A lot of the material for this class was mixed with systems information. Know systems really well. Additionally, you're gonna have an anesthesia and surgery project that you're gonna have to do, which is kind of like the practicum, except less intense. You get assigned a case, but then you get to make your case from there backwards and explain why you know it's that and how you would diagnose it. Pharmacology returns. Pharmacology this semester is much more enjoyable, in my opinion, than last semester. The best part about pharmacology is you start getting into anesthesia drugs, which is super great. Darcy teaches it, super organized. In addition to anesthesia stuff, you're gonna do endocrine. The best thing about endocrine drugs is that the teacher who teaches it really simplifies it out for you, tells you all the essentials that you need to know. So if you didn't really get a hang of endocrine and systems, it's much easier to understand and really grasp in pharmacology. Anesthesia and surgery, most hands-on course for the semester. You're gonna get to do some fantastic labs led by Darcy and Dr. Lynn. They are both two fantastic teachers and you will absolutely love it. So anesthesia stuff, Darcy has PowerPoints, but she also has handouts. Know the study guides and the questions to the study guides, and you will be good for the final and for the practical. So the practical is all of Darcy's stuff, again, fantastic. You need to know it. Surgery is super fun as well. You will have a draping and suturing lab, which is super fun. The best thing about Dr. Lynn is she's gonna go over a review, and I really, really like how she does her reviews. So with eGram, the reviews are basically what you need. With Dr. Lynn, you don't have to like just memorize material kind of situation, because she tells you the material that you need to know, but you have to go find the answers to that material in the PowerPoint. And the surgery exams were honestly probably the easiest ones for the semester, just because Dr. Lynn's such a great teacher and her reviews are really helpful as well. Over the summer, after your second semester of second year, practice your suturing because you're gonna have to do it in surgery next semester. Also, you're gonna need a surgery cap for lab and the practicum, and you're gonna need to get a suture kit. Systems. This is your big mama class for the semester, okay? It's gonna be super, super challenging. There is a notoriously difficult exam, first exam. This is on ophthalmology, so eye stuff. What I did is I proactively over the summer grabbed some of her old PowerPoints and learned the drugs. Know your ophthalmology drugs. Your second block in systems is gonna be endocrine. In my opinion, this was probably the hardest block in systems, just because eGram, her PowerPoints are all paragraphs, and that really makes me struggle, and it's just a ton of information. Be encouraged because she will go over a review. The next exam is gonna probably be a little bit easier, because you have Dr. Green and Dr. Martin on these. Now, Dr. Green's gonna go over ECG, so if you didn't get it first year, you can get it again this semester. Dr. Green is amazing. He really knows what he's talking about. He's still practicing. Cardio is a lot of information, and a lot of it is just basically understanding how the heart works. Livesey also teaches you horse endocrinology and horse cardio, so be prepared to do small and large animal for both of those topics. The horse cardio is much easier in my opinion. She gives you a handout. Know that handout, because pretty much that's all you need to know for that portion of the exam. In the fourth block, you do neuro and you do derm. Derm is really awesome because her PowerPoint's super simply formatted and it's really straightforward, organized information. So I was able to make tables and organize the information really nicely and just study that. However, neuro, she gives you handouts and she gives you PowerPoints. The disadvantage to neuro is one, I feel like we really rushed through it. The second thing is all of our lectures were recorded. Systems also had a couple labs to go with it. The first one is going to be your ophthalmology lab. You will get to actually do an ophthalmology exam on live pets. Second lab is derm lab. This lab, she lectures, then we practice doing skin scrapes on oranges. Our other really challenging course for second year is theriogenology. A lot of information about how all the different breeds do it. This course starts at a really good note because Dr. Ciccarelli starts out with pig, and she is super passionate about what she does a great job at teaching. Dr. Tabari teaches several species. The first one in block 1 is going to be cows, and I struggled more with Dr. Tabari's material. The second block's gonna get a little bit more challenging. Dr. Carlton is very passionate about what she does. Go ahead and rewatch those lectures because it helped me tremendously, because the first couple lectures of hers, you're gonna be like, I have no idea what's going on. But then if you rewatch them, you'll feel a lot better about it. Dr. Ciceri teaches us small animal theorio, and she does a fantastic job. She's super organized, super to the point. It's everything you need to know. The last block in theorio is going to be small ruminant and cow. Cow is taught by Dr. Roberts. I really enjoyed her lectures a lot. Dr. Martin taught small ruminant, and her lecture was a little bit more lengthy than the cow lecture, so be prepared for that. Finally, we have Vet Path 2. You start out with respiratory and CNS. You get to do a CNS lab, so you get to dissect a brain. You also have a skin section, which is block 2. The third block is gonna be GI, taught by Dr. Phillips. GI is a lot of information, so it can get a little bit overwhelming. Finally, your probably most information heavy block is your last block. All of these sections are taught by Dr. Powers. The thing about her PowerPoints is that they're all pictures, and then she has super long handouts. Only know the purple stuff. Rest of it, she's not gonna test you on. First semester final was pretty challenging and stressful just because it was back to back to back to back to back, and you have a lot of classes with a lot of information. Second semester finals is a breath of fresh air compared to first semester finals because they're way more spread out. Each final individually was not overwhelming, but if you looked at it overall, it was kind of overwhelming. So there's a secret that most people don't tell you, the capstone exam. This is an exam that's going to cover pretty much everything you've learned so far. The study guide is literally 10 pages. Find your big or another big that has that study guide and start filling out that study guide. So make sure, especially for none of your courses second semester of second year, you don't cram. You really get all of that information down because it's gonna come right back over the summer. Now, I know that was a ton of information. If you have any other questions or want other advice, be sure to put them in the comments. I'm here for you guys. And just as I did with the first year video, I will also try to update this one as changes occur throughout the years. I hope this was super helpful, and thanks for watching.